Scabies is an infestation of the skin caused by a parasite called the scabies mite, also known as the itch mite. Female scabies are about 0.3 to 0.4 millimeters long, and the males are about half that size. The mites mate on the surface of the skin, and then the females burrow into the upper layer of the skin to lay her eggs. Typically, an infection in an otherwise healthy person will consist of about 10 to 15 mites, though it can be more. The male mite dies on the surfaces of the skin shortly after mating. After burrowing into the top layer of the skin and laying her eggs, the female continues to live there. After 3 to 4 days, the eggs hatch into larvae. Then they mature into adult mites after 14 to 17 days. Scabies mites can crawl, but they cannot jump or fly. When attached to a human host, these mites can survive for up to 2 months. However, they can only survive about 2 to 3 days without attaching to a body. Scabies mites thrive best in hot, tropical climates, though it is prevalent everywhere. Since scabies mites cannot jump or fly, the only method of transmission is prolonged direct skin-to-skin contact with an infected individual. The most common way for adults to transmit scabies is through sexual contact. Therefore, it is considered a sexually transmitted disease. Scabies is a very common worldwide concern and can be transmitted to anyone regardless of age, race, or ethnicity. Typically, shaking hands or quickly hugging will not be enough to successfully transport the disease from one person to another. Also, normal physical contact in a school setting is usually not prolonged enough to spread the parasite. Secondary to sexual transmission, it is most commonly relayed between mothers and children or hugging friends and relatives. Scabies infections tend to present in bunches, and they can advance exceptionally quickly in overcrowded places such as nursing homes, prisons, and child care facilities. A scabies infestation in an animal is also known as mange. Animals cannot transmit this type of scabies to humans. The mites that infect them are similar but not quite the same. Mange is common in dogs, cats, pigs, horses, sheep, and other animals. These mites can temporarily irritate a human, sometimes causing minor itching. The parasites cannot thrive on human skin and will die quickly, relieving any itching or discomfort. There is no conclusive method to prevent the transmission of scabies. The most effective means to avoid conveyance of the disease is to refrain from direct physical contact of any infected persons. An infected person should quarantine themselves and administer the intended treatment immediately. The potentially exposed, namely sexual partners and household members, should also seek treatment in order to minimize the possibility of the epidemic. The elderly and people with weakened immune systems are particularly susceptible to scabies infestations, sometimes without any outward signs or symptoms. Contrary to popular belief, the infestation of scabies mites is more closely correlated with overcrowding and poverty than poor hygiene. Increasing personal hygiene practices will not prevent individual transmission. However, as a society, it may assist in controlling length or severity of any potential outbreaks. Common symptoms are skin rash consisting of small red bumps, blisters, or scales. The blisters may contain blood crusts, profound itching, increasing in intensity over time, and typically worse during the night. There are burrows or tunnels underneath the skin that are difficult to see. A host is able to spread the parasite immediately, but the symptoms may not appear for up to 2 months. Because itching is the most common and most prevalent symptom, scratching is unavoidable. However, if scratches break the skin, the body may be exposed to secondary infections. Common areas for adults to become infected are the webbing in the fingers and toes, wrists and back of elbows, waist and belly button, underarms and nipples, side and back of feet, genital area, and buttock. Common areas for infants and small children to become infected are the head, face, neck, palms, and soles of the feet. Without the use of an effective treatment, the infestation of scabies mites will not subside. A doctor can diagnose an infection by scraping the skin in search of evidence, such as adult mites, mite eggs, or mite fecal matter. However, this method is very unreliable, only finding evidence in about 50% of cases. Many times, doctors will simply treat the infection if the patient presents with the appropriate symptoms. Presently, the only treatments available for a scabies infestation are by a doctor's prescription. There are no medicines that combat scabies mites sold over the counter. Scabies infections can be treated with either a topical cream or an oral dose. These prescription medicines are known as scabicidal drugs because of the debilitating effect on the scabies mites. Incidents of treatment failure are possible, but not terribly common. Symptoms from the infestation will begin to decrease in intensity a few days after initial treatment. After 1 to 2 weeks, the majority of discomfort should have subsided. If symptoms have not receded, or if there is new evidence of mites after 2 weeks, a second course of treatment may be necessary. In addition to the prescribed medication, linens and clothes should be dry cleaned or washed in hot water and dried on high heat to ensure the complete extermination of the mites. Since mites are unable to live without a host, it is only necessary to cleanse clothing from the previous 2 to 3 days. Anyone that has been exposed should also undergo prescription treatment and have clothing and linens washed. Immediate mass treatments will improve likelihood of complete eradication. Although some scientists disagree, most believe there are an estimated 300 million new cases of scabies infestations worldwide each year. In the global population, about 1 to 10% are infected. However, in overcrowded and poverty-stricken areas, the infection rate may be closer to 50 to 80%. In the United States, occurrences have been on the rise since 1973, and it's calculated that there are approximately 1 million new scabies infections each year. State and local statistics are non-existent due to the fact that doctors are not mandated by health officials to report cases. Scabies infections have been known to occur throughout the world since ancient times and have been reported for over 2,500 years. Though it is a worldwide epidemic, exact statistics are unknown because 1. Many incidents occur in underdeveloped countries, and 2. It is not mandatory for doctors to report the disease to health officials. The International Alliance for the Control of Scabies was assembled in 2012, consisting of about 70 researchers and public health experts from over 15 countries. The group has successfully captured the attention of the World Health Organization. Subsequently, the World Health Organization's official list of neglected tropical diseases now includes scabies. With the help of IACS and the World Health Organization, more overpopulated, impoverished countries will receive the assistance they need in fighting this parasite.